Hello, my name is Hubi Haji Mohammed Manaren, and I'm PhD candidate to Ottawa. And this is Public Health Governance, a paid board assignment in AP 5210, winter of 2021. So the objective of this is to define public health, differentiate upstream and downstream approach, understand the historical events influencing public health in Canada, differentiate statute and regulations, and federalism and differentiate federalism. How does federalism work in public health? And understand the delivery of public health at a municipal level. Explore various public health deliveries arrangement in Canada, and understand coordinating mechanism in place to activate public health response like COVID-19, and to access the hyperlinked important sites for Public Health Ontario. So because I'm situated in Ontario, my presentation will be from the perspective of Ontario, but I encourage you to, I also have a site that kind of now compiles all the public health arrangements in different provinces and territories. And this is mainly for any student, international or from Canada, just to expose them to those sites so you digest that and be able to enjoy your program. So, what is public health? According to the Dictionary of Epidemiology for the edition New York Oxford University Press, public health is the organized efforts of society to keep people healthy, prevent injury and illness, and premature death. It's a combination of programs, services, and policies that protect and promote the health of all Canadians. I had to personalize it for Canadians. So this is an image I want to show you. As you can see here, so this is upstream, downstream. So public health, you want people to stay healthy. So what are you doing? You're creating policies and programs to protect and promote health. And that way they don't end up sick, and you decrease downstream impact, whether through screening, health promotion, policies to keep people healthy, and that way people don't get sick. But if we ignore here, we're gonna have a pile up here. And I think COVID has displayed that if we don't focus here, the acute care is gonna be filled and the system will be overwhelmed. So I think public health is better understood by everyone now, given COVID reality. So let's go. Keep that in mind, what public health does. Anything from crossing the street to the cross lines there, to the speed limit, to the lights, where they're situated, the school zones, all those is to prevent injury and protect the people. And all levels of governments always put those structures in place. And like COVID measures are all to protect people's health. But then sometimes it's like settling for your risk, because public health intersects with everything. Every sector has a public health element to contribute, and because of that, it's very complex and needed situation. I feel like governance is all about public health. So let's go. So throughout this program, our professor encouraged us to kind of go learn, and I really liked his style, and I learned so much about governance and how they interact, and I appreciate him for that, Dr. Fafar. So this is a pandemic. So I created this slide to kind of reflect how pandemics and historical infections, which are a bit more critical than other things, impacted our public health shaping. So pandemic, international, and I want to talk about the international health regulations and public health modernizations that happened over the years. As you know, public health like even way before, even municipal, the health units were created way before Canadian Constitution happened. That's how old our health units are, and they always had to deal with those now vaccine preventable illnesses that then needed a lot of public health measures, and a lot of healthcare professions, medicine and all that are rooted in those issues. But having said that, also non-contagious chronic diseases which are more prevalent in this modernized world, and prolonged life, um, um, increased life expectancy, we have more chronic diseases to also deal with, which some resulted from the nature of our lifestyles and immobility and health inequities that our modern world has created. So to get to the point is that IHR, like International Health Regulation, was created to deal with the European pandemics and infectious diseases. But World Health Organization adopted IHR in 1969. So IHR regulates public health events and emergencies that have the potential to cross borders, like COVID-19, and it's a legally binding framework for the countries that signed it. So as you know, in 2003, SARS happened, and when SARS happened, it was we got too comfortable for so long, and that kind of alerted so much of the public health regulations and how should we deal with the future public health and all that. So one of the things that happened was actually in 2003, when after SARS, Public Health Agents of Canada, that you can see now, that's playing a huge role in COVID-19, was created. And in 2004, actually, the Pan-Canadian Public Health Network, which I will show you later, and I have a site show, was created, which is network of chief medical officers of health of different provinces and expertise science from different and non-profit organizations, all those contributing to inform public health. And it has a mandate, and when it's activated, when provinces are overwhelmed or something is a threat to public health, they have levels of activation and logic framework that they use that activates it. In 2005, the revision of the IHR was done, which kind of modernized to reflect the realities of globalized world. And in 2007, actually, Public Health Ontario was created. So Public Health Ontario is an arm-length organization that's autonomous, and that is actually like it's the CDC version of Ontario. And what they do is expertise and knowledge and surveillance and laboratory testing and all that trainings and surveillance and data. They do all that to inform, so the consumers are like Chief Medical Officer of Health in Ontario, public health units, organizations, they all use that, consume that expertise. And now in COVID, so I'm sure so much is going to change, and pandemic emergency response will be further modernized and sharpened. God forbid for future events to occur, but that's the reality. Public health modernization, public health institution will continue for sure. And yeah. So I just want to differentiate a couple of things. Ontario government of Ontario definitions. I don't know what, but yeah, government. So I got this from I sourced them. This is actually from the what they differentiate with what's the statute and what's the regulation. So statute, also known as an act, is a law passed by a legislator. So like example is 1967 Constitution Act. Canada Health Act, Ontario Health Protection and Promotion Act, which governs public health delivery in Ontario. And regulations are rules that set out the details of practical application of the law. They are made under the authority of statutes, like public health measures, etc. So to go here, like chief medical, according to Public Health Protection and Promotion Act in Ontario, for example, gives, this is one article from there, I got it from there. Actually, I also, in this package of paid forward, I also created a mind map for public health for this act that's easily readable and friendly. So that will accompany this. So according to that article, the Chief Medical Officer of Health is of the opinion that situation exists anywhere in Ontario that constitutes or may constitute a risk to the health of any person. He or she may investigate the situation and take such actions as he or she considers appropriate to prevent, eliminate, or decrease the risk. So they have this authority and power to do something based as given by the HPP Act. So the thing is, and there were discussions in class, should a medical officer, a chief medical officer of health who is not elected, have that power? But you have to remember this, and he does have a power, or she does have a power, depending on the province, for Ontario at least, because in COVID situations, they have to make calls, they have to make judgments, and they have to create, based on the best information that they get, decisions to protect the public, and people might not like it, but that's the power to make that decisions that's given to this person by this law, the Ontario Health Protection and Promotion Act. So if one says, how can he have that power to do that? He's not even elected. But you have to know that he is acting under this act, which is passed by a legislated body. So in a way, he is within that framework who are elected, actually. So the thing is, people might say, oh, no, we don't have, who knew the pandemic, nobody had that in mind. But pandemics are not new, as we reflected on the historical events, and by paper and by humanity, this thing, pandemics really devastated humanity, and it's not something new. Everything was by the book, by the paper. We were ready for it, but there's always human factor, right? So in that argument, I sided with the fact that pandemics are not new. This was created in order to deal with that. You cannot say this is localized to deal with localized issue, but pandemics were never localized before. Like, they crossed borders, towns, cities, and devastated people, and this is the product of that, and this is the best thing we have, and that's the reality. So next, this is just to show you public health roles and responsibilities. So in Canada, we have federalized arrangement. So as you can see here, oh my God, I hope my brightness wasn't on. As you can see here, a provincial, so public, according to the constitution, the federal have the roles are clear, and provincial have the role of health and public health, and but you have to know what's called residual powers, which will overlap with public health, because that's the residual power that they have to keep people healthy. And you have to know some areas of Canada also, the federal government, like territories, they have the role of health delivery, even though health delivery is within the provincial. And the municipalities are really, even though they way older than the province or the federal government sometimes, I feel like they were cheated out of it. They are absolutely under the authority of the provincial government when it comes to public health, and what they do, they're just delivering service that is enacted by the provincial government. So, but the things that they do, municipalities, are really public health things, right? Like police, fire stations, school boards, like local planning and development, all those are directly impact like the services of public health um, issue. Okay, and social welfare, like bylaws, property and waste and water management and other utilities, and actually a lot of things public health uh, over technically I was telling you public health is ubiquitous. It infiltrates anything. You can turn the other side of the coin and you will see public health. So anyways, to make this story short, public health exclusive provincial jurisdiction. I could be wrong, but that's my understanding. And the federal government, of course, they have a multi-jurisdictional impact. They deal with things that have cross borders, and that when they have this activation system that I'll go through, when they realize this is a bigger impact that needs collaboration, they will get involved, like something with COVID-19 and disasters that are beyond the capacity of that province, as well as something that's impacting multi-provincial territorial aspect. So municipal or regional, what they do is, depending on where you are, what you call them, they're interchangeable, the naming, whether you call them regional, local, municipal, etc. They do service delivery. Ontario Public Health Units exist within the municipal structure. So I say I'm talking about in reference to Ontario, but I will share the link in I have the links down where you will see each province has a different arrangement, but I know in Ontario it's built within the structure of municipality as a provincial directive. So what they do, they follow the provincial directives, and local government is partisan, by the way. They don't have a parties, and the person who works in the local government is not actually a public servant. They run, like, at least I know in Ontario, like Ottawa is managed by in a business like corporation, but public health is built within that structure. It's cost effective in a way because they don't have to run separate. Like I told you, a lot of the things municipals do is public health, so it makes sense to work with that structure and to function within that structure and capitalize on and be more efficient. Um, so general structure of public health units in Ontario. So just to show you, like, Ontario, how does it work? So there are 44 Ontario municipalities that are all under 35 public health units in Ontario. And by the way, Ontario is now trying to lessen the number of public health units. But when they were trying to work on that, especially with the conservative government that's in charge now, what happened was the pandemic happened, and I cannot, I cannot, I, I personally like the arrangement that is now. I also know that I'm glad this transition wasn't activated before COVID-19, because it would have been unfair to transition something before COVID-19 and end up with the COVID reality and then all the confusion and the blame, So I'm glad before that transition happened. Now, so what they're doing is they're making them into 13 or like lesser. So some public health will be amalgamated and collapsed. And I can't see that with COVID. What we're learning is the local issue and local reality is so significant, and the more you collapse the governance aspect of it, the farther it gets from that. So I know LIN, which is local integrated health network, which is also deals with the primary care and other services that are not public health, but sometimes they collaborate and partner about an issue. They were already going, they were dismantled, and then they were transitioning, and they were gonna be called now something called Ontario Teams, Health Teams. So that was just dismantled and was moved around. The governance of it, I don't think the day-to-day delivery was going to change much, but the aspect of governance and administrative was going to change. So that is still, I'm sure that's going to slow down. I don't know if it's going to be reversed, but COVID happened. I'm sure in the future you will have a better clarity in the next semester or subsequent years. So public health is an official health agency established by a group of urban and rural municipalities to provide more efficient community health programs carried out by full-time special qualified staff, Board of Health. So this is how it's defined by the HPP Act. So Board of Health functions under legal authority of the HPP Act, and the Minister of Health and Long-Term Care audits health units as per accountability framework. So these are all going to be included in the links. So this is for as per HPP Act. So HPP Act micro details how public health should be run by the health unit. So this is actually Ottawa's health unit. So it says that according to the HPP, it says that a council representative cannot be so you remember I told you public health units in Ontario are built or exist within the structure of the municipal, and in a way is to accommodate the municipality as well, so they have an input into the public health delivery in the community, right? So that act technically says that for public health unit, who there are 13 health board members, like you can see. This is and a chief medical officer. Okay, so let's count them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11. So I don't know if they to their full potential, or I'm missing names. I could be wrong, but one thing I learned is in Ottawa 1, I think one person is missing here. No, Ottawa 1, no, this is full actually. They have 6 council representatives and 5 public health figures that have a background like nursing or medical or psychology, or people who are really educated or understand about public health. Okay, so one thing with that is, but this act says that a council representative cannot be less than 3 and more than 13. So in that sense, if they're more than 13, I guess they overtake the whole place. It becomes councilized. There's no representation for the public. So when they're doing this role, they're doing a public health and with the insight of councillors, right? So, and this is Vera Edges, and that's our medical officer of health. She's doing an amazing job, and it's kind of semi-autonomous, and Public Health Act really explains in details what the roles and the powers of medical officer of health is, and then there's chief medical, and who do they report to. It's a balancing act, and if you want to watch the videos, I'll add it below the link of it. In with COVID, they have it recorded, the Zoom recorded on the City of Ottawa, and you'll be able to see the dynamic and Vera Edge talking and they're interacting. One thing I need to mention though, speaking of representation, when it comes to governance, there's a lack of representation. And what impact, like you can see when you can look at all these people, you don't see Indigenous person, you don't see Black person. I looked over different health units like the Kingston, etc. and these jobs are actually posted on the when if you want to do a health unit or something. No, it's appointed by the um, by the city, you know, who's going to be on the HPPA, and the board also chooses the chief medical officer, a medical officer of health. But the question is, and they are kind of semi-autonomous because they are a bit built into the city municipality, so, and then partially autonomous, I guess, and then they governed to some degree also by the act. So it's a weird arrangement, but it works. But I think if I had to leave something, it would be not representation. I think that will make a difference. So if you want to explore more structural of all the provinces, I really want you to go to this site. I'm gonna add it to the clip play at the end of it about Disney looking into this site. So this site really has explore structural profile of public health in Canada. So it has the provinces, territories, federal, regional levels, and chief medical officer of health, and all the reforms that were relevant. And it's from the Center of Collaboration, National Collaboration Center for Health Public Policy. I think it's Quebec based, because I also see Institut National de Santé Publique. So it's a good site. If you don't know what's going on in Canada and you were the international student, or you are just from Ottawa, like I lived in Ottawa for 20 years, it's my city. I came to Canada 1999, like 20 years ago, and this was my city, it's my home. So I know that I had no clue the details, and public, like, it's easy to understand federal and easy to understand the dynamic between federal and provincial, but when it comes to the details of public health delivery and service delivery, and those arrangements, and it's I can't say messy, but it's a bit complex, and you really have to spend a lot of time reading. And I think I appreciated this semester the fact that our teacher gave us assignment, so we do our own exploration at our own terms, come with our own clarity, and when we come to him, he will kind of further give his expertise and guide us through it. So when it comes to public health, we have this CDC, our CDC versions in Canada, public health agencies in role of CDC, the Center for Disease Control, that's what they call it. So there is a BC Center of Disease Control. So Public Health Ontario is one, British Columbia is this one, and there's Quebec National Institute, and they do amazing job. And as I explained earlier, they provide expertise and insights, and these are three to explore if you want to know about public health. I know I did my assignment on Ontario. I know Ontario one is actually what's called autonomous, in the sense that they are the board is selected by the Lieutenant Governor of Ontario, who is not who's is so they apolitical, and they kind of withstand time, right? They're not subject to government change and stuff like that, which is a good thing. So like, and that is like the person representing the queen on the province is the person who selects board of health. Same idea, amazing talented people. When I looked into their profiles, at least this is the one I did, again, one thing was they weren't diverse. So I don't know, that's a pattern I'm observing, but yeah, but definitely they have the qualifications and expertise. It was nice. I saw one person that had it was indigenous, I forgot the name, but you can go and find the health. When you go to their site, they're going to show you how it's governed and who runs it. And they have yeah, and same thing, they're doing great job. My colleagues presented the Quebec one, and another group of my colleagues presented the British Columbia. It was such a learning. Yeah, it was really learning. I learned so much. Um, so so what happens when something happens like COVID-19? Like, so as you have seen, like COVID-19, when it happened, you can see the communication going on, World Health Organization, Public Health Agency of Canada, and public health agencies like that we just mentioned, as well as the public health units and all that. How do they function, you know? So technically, the IHR requires that the countries have vocal point of communication with who? So VAC does that for Canada, and core capacities for surveillance and response, designated points of entry. So flow of data sharing goes up and back and forth, and flow of communication to the public, because public health is all about communicating risk, perception and all that, right? So this is actually what's called, you remember I was telling you Public Health Network when it was created, and I was telling you Public Health Network is expertise and all that, and it's activated when it's ongoing network, but it contributes a lot to emergencies. It's like a mechanism of smoothing out that federalism nature that kind of compartmentalized. It's like that smooth um, communication activation, you know. So what they do is, so this is the Conference of Federal, Provincial and Territorial Deputy Ministers of Health. How do they get informed in order to do their job in decision making? Because they are elected, right? So what happens, there's information going on. So there are NGOs, community of practice, liaison committees, provincial agencies, academia, government, like provincial agencies can be Public Health Agency of Ontario or British Columbia or National Institut de Santé of Quebec, academia, government ministries, departments, and local health groups. So all these are informing these task groups. Health people and community steering committee. So, and then there's a communicable and infectious disease steering committee, and there's public health infrastructure steering committee. So they're all informing this, and these are all communicating, and they are feeding into this public health network council, which has Council of Chief Medical Officers of Health, and they inform it. And if you pay attention with COVID-19, you can see this whole thing. They coming to the table, you know, presenting to the public. But where are they getting the information from? This is how they're getting informed. Okay, just to show you that how public health network, as I mentioned, was created 2005 in response to SARS. So I guess it prepared them better for how to deal with COVID-19. Talent pool of experts, that's what they call. So this is showing you, according to that, when something happens, how can we achieve coordinated federal, provincial, territorial response requiring collaborative and interoperable infrastructure response capacities and harmonized activities. So this nice, it was updated in 2018 article that talks about how this gets activated. So let me walk you through. So when human disease and animal surveillance show something, it comes to the provinces. Notification of event potentially requiring FPT public health response, like COVID. COVID came, this is required. There's also international report surveillance. Let's use COVID as a case study. So it's reported. And if there's a domestic outbreak, it also gets reported, and network monitoring. So initial assessment, you assess the situation, okay? Does it require coordinated FPT public health response? If yes, if no, you do ongoing monitoring, okay? So if yes, then you move on to this situational assessment. So they have response levels. They have response level normal is the green, yellow is the heightened, 3 is escalated, and 4 is an emergency. So COVID-19 was emergency, right? We're in a perpetual emergency now. So ongoing monitoring. So if it's green, that means it's normal, so you go back. If it's so then you ask for situational assessment. Response is level 3. Depending on the decisions, you have to read the article. If it's yes, then you go initial response planning, capability assessment. If no, then you go back to this strategic review and approval, response implementation, response review, coordinated response still required. So it tells you how things can be de-escalation. If it's de-escalation, no. If it's no, you go back, right? If it's yes, you go back. If things need more coordination, you go back. If there's no need for that, you go into de-escalation. We're not at de-escalation yet for COVID-19. There's no ongoing monitoring. So and this is after review. Like you remember, after SARS, there's after incident review, and there's a lot of recommendations, and all those informed, and you have seen how it was modernized, and all those agencies were created to deal with it, and to prepare for future, which happened, and it's COVID. The point here is this looks like really efficient system, and with COVID, I'm doing this just to give you what existed pre-COVID, and I'm sure it's modified now. I know I mentioned this to Dr. Favar, and he showed us actually a complexity of what's happening now, which it's not fair to expose you to it now, but it's for you to understand this, gives you that foundation. So anything that changes, then you have a baseline to grow from. Does that make sense? Okay. Yeah, so this is the same thing, except now is the how it happens, and it's just repeat of what I just mentioned. So the support to the SAC, TAC, LAC are actually technical advisory committee, logistic advisory committee. Like you have seen, COVID needed a lot of technical advisory committee, logistic advisory committee, special advisory committee. So actually now there's a special advisory committee on COVID-19 that is from the Public Health Network, and it's just showing you how those different groups inform the special advisory committee, etc., in the chain of decision making. And that's how Federal Health Portfolio Operations Center and PT Emergency Operations Centers, like they're in communication. Yeah, so it's just to show you, even though things seem compartmentalized, they're not. There's ongoing connection and linkage going on at the background, and informing decisions, and yeah, it's an amazing system. It's amazing system, I mean, like, but you still have to, nothing's perfect. I'm sure we humans, every experience, we can only improve, right? And who prepared for something as in the magnitude of COVID-19? Like, it's really, that's the human limitation, right? Now we have a new reference point. So, but you'll think there were movies made about pandemic looking like COVID-19. I just human, we have that weakness where we ignore things, or we just have to we do our best, and then we just wait crazy stuff to happen. So I created these links for you. I honestly I found this in the so there's my reference is actually Association of Local Public Health Agencies. I have an article, and if you read in the appendix, they list just these abbreviations, but I had to go and find each link each link. So I linked for you to make your life easier because it's paid forward, right? So that way you can click and explore. Two ones I want to mention really that you must go to is actually it is, let's go to here. So this is significant, and this Public Health Ontario. So this is also important. Where is my Lean is becoming Teams now. Sorry about my health promotion. See next. Oh, I forgot. I have another slide. So let me start over again. So these are important hyperlink sites for Ontario governance, and I pulled them together, and I had to find each site and a hyperlink. So you can go through this. Important ones, actually, I would say go to this because this really provides you it's created, it's Association of Local Public Health Agencies, and it actually has the orientation manual for public health unit board members. So if you read it, it really educates you well. And this is the one I just went through, overview of Pan-Canadian Public Health Network and how they work. It's that article. And those are the ones I want to point out. Board of Health. Yeah, but they're all important. Okay, Minister of Health and Long-Term Care. So it's from Ontario's perspective, but these are important things. So let me show you another site here. Ontario Public Health Association. Public Health Ontario. Yeah, so I will definitely ask you to go to this one. Okay. And so this is SARS recommendation and things. So this is also a good one. Excuse me. So these are links, and if you look here, I have the charts. As I have a couple of references here, few references. These are actually my references, and if you go here, you can also, each government that you can go to, always look for the organizational chart. It just gives you perspective of how it's governed. Okay, so this is work done for you to explore links and important organizations.